if we simply rely on kind of retraining our breathing method, that's a powerful tool for our nervous system. That's a powerful tool to decrease the amount of stress that our body's up against.
You're watching the Wow podcast. I'm Jennifer Robin. Full disclosure is in the description. Today on the show, we have Dr. Julia Sadove-Lopez, the founder of Auris Wellness. Dr. Julia consults with parents to help them make informed decisions about their child's oral and airway health. She provides objective guidance on treatment options and helps families connect with qualified, airway-focused providers. She's joining us today all the way from Portugal. Welcome, Dr. Julia.
Thank you. Thank you for having me today.
So for my listeners who don't know you, can you tell us a little bit of how you got started with, I know this is a mouthful, biological and airway dentistry. So tell us how you got started with that.
Yeah, absolutely. So I know, I've been listening to some of your podcasts as well, and just kind of the things that we're blissfully living our life unaware that there's a different way to do things. And that's how I practiced the first several years of dentistry. When I graduated from dental school, I was just practicing routine general dentistry. And it wasn't until I relocated from Indiana to Chicago and I was looking for a different job that I even came across an office that advertised itself as being a holistic dentist. And I quite honestly, just given my background and how I saw healthcare at the time, I didn't even know what that meant. But it was an office that was in a perfect location, and I just moved to a new city, and I went in with an open mind to find out what they were all about. And that clinic practiced what they call biological dentistry. And both are types of a more holistic approach to dentistry. Biological dentistry is going to be more focused on sort of looking at the interaction of different dental materials. So we consider things like metal fillings and the impact that that might have on our body, and then kind of vice versa, how what's going on in other parts of our body is also impacting parts of the mouth. And then from that experience and from my network that I began to grow practicing through that lens, I discovered a little niche called airway dentistry.
Okay.
Airway dentistry is more about thinking about how really the roof of the mouth is the floor of the nose. And so the functions of our breathing it's going to be just intimately tied with how our growth and development has taken place and how our jaws form. And so I was really fortunate that I found my way into a research opportunity. Some of your listeners may have read the book Breath by James Nestor.
Okay,
In his book, he speaks a little bit about some of the pioneering research that was done by two dentists, Dr. Kevin Boyd and Dr. Mariana Evans. And I joined Dr. Kevin Boyd's team to be able to do some research where we were comparing anthropological skulls from the Penn Museum to modern day patients and looking at how our bones and our jaws are different in today's world and our modern times. So it was really, it was one of those things that you kind of can't unsee once you start to understand how things have changed.
Was it a striking difference? I mean, was there like a significant difference?
Yeah, I mean, I think that the biggest thing is just the skulls back then, there was no crowding. So all the teeth, there was room for all of the teeth, including the wisdom teeth. Everything fit like a beautiful kind of arch form is how we would describe it.
Yeah.
And compared to today, we kind of see everything's really sort of squished up, and braces have become the new normal.
Yeah, I was going to say it's normal, right? It's a normal thing. Parents expect to budget for that expense, you know?
Absolutely.
Yeah.
Now we say kind of common isn't normal, right?
Right.
One of those things we have to rethink, that this isn't strictly genetic, that there's some other things at play. So
I'm intrigued by how the teeth used to fit like they're supposed to, because pretty much everybody I know had, like you said, the crowding.
Yeah.
You know, I had it. I went through years of braces and had the back teeth removed,
Hmm.
because they didn't, like you said, they didn't fit. And goodness. So this is interesting for me.
Yeah.
Another, there's a vocabulary word I want to get out of the way early in the conversation, just make sure all our listeners are on the same page. And that's, I'm going to probably say it wrong, craniofacial. Can you just let us know what that means?
Yeah. So I know I had heard that you had discovered the world of fascia. So I'll make a quick
Mm,
distinction. This is craniofacial. It's slightly different.
facial. Okay.
Hmm. But fascia does play a role. So we'll come back to that topic as well. But craniofacial is just the way of describing essentially the bones of our skull or our cranium, and the bones of our face. So really, I know people don't pay much attention. We break a muscle in our arm or a leg or something, but there's so many little bones in our skull and even in our face that we just don't think about what's going on in there in terms of development. And so that's the term that just means kind of putting it all together. And I think the one of the interesting things is, again, sort of touching on that, is we often expect that the development of those bones is going to be predetermined genetically. But while there is a genetic component, there's also a lot more that comes into play when we think about how we use our muscles, and during the development phase, how we're chewing, how we're swallowing, how we're breathing, impacts from our environment. So there are different things that are at play that are going to influence from the use of the soft tissues and how things are functioning. That's going to influence the growth as well. And I think now is probably a good time to say, I think the biggest distinction that I would hope that any listener listening in today would take away would be understanding nose breathing versus mouth breathing. That's one of the big topics that I'd love to dive
Okay.
deep.
Yeah, I would love to hear more about that.
Yeah, perfect. So I think, again, having gone through, when we went into dental school, one of the things that surprised me most, we dive into like a head and neck cadaver lab when we first start going through dental school. And we're so used to seeing our nose as just this little projection from our face. But our nasal cavity takes up a lot of space inside of our skull, and we just don't think about that. And our nose offers a variety of functions. It's not just smell. Our nose is actually designed to humidify the air that we breathe, to filter the air that we breathe. So it catches a lot of debris from the environment, and it's also creating like certain chemicals in our body, natural chemicals, nitric oxide, for example, that serves a certain purpose in the body. It affects blood vessel health and other things. So we just don't give our nose enough credit into what kind of functions it's supposed to be doing. And so beyond that, if we really are designed to breathe through our nose. And so when we start to breathe through our mouth instead, it becomes something where it's our backup system. It's not going to be
Mhm. Mhm.
serving to drive the function as well. And so what can happen is a lot more particulate matter from our environment can get in. It can irritate the throat. It can irritate the lungs. It can actually cause the tonsils and adenoids that reside in our throat to start to swell, to try and protect ourselves from catching all of that other debris that was supposed to be filtered. And so there's sort of this cascade of effects where, for a variety of reasons, we may start breathing through our mouth instead of our nose, but then it becomes a harder cycle to break to get back to, because we've sort of
It's,
opened the default pipe. And
yeah,
now going back to training ourselves to breathing only through our nose is a lot more complicated. And it can have a surprising effect on a number of different parts of our health.
interesting. And and you'd never, most people would not associate the breathing in the nose with dentistry, right?
Mhm, absolutely.
Um, I don't know about daytime, but I know nighttime, a lot of people, even if they are breathing through their nose during the day, as soon as they lay down to go to sleep, they turn into mouth breathers. So it's
Mhm.
interesting. I never thought about all of the junk that ends up in your body because your nose isn't filtering it out. That's an interesting thing to think about, especially when, I've heard that just the environment of our bedrooms and the dust mites and the dust and the pet hair and the whatever pollen or whatever's floating around in your air that you can't even see, all that microscopic stuff. So interesting.
Absolutely. And that not only what you mentioned about lying down to go to sleep at night, it can be really disruptive to our sleep. So when people are more likely to mouth breathe at night, they're more
Yeah.
likely to snore, which is going to be kind of a warning sign. A lot of people, again, think snoring is just a normal part
Yep.
of what happens.
Yeah.
But it's your body's warning sign that there's some resistance to the airflow and something's not going right. And that can have different effects through different phases of life. In children, it could lead to interrupted sleep and look sort of like maybe someone is going to have more issues with bedwetting, or maybe their
Mhm.
attention or learning during the day is going to be impacted. Whereas in adults, it might have cardiovascular effects or daytime fatigue.
Wow.
And
Would
there
never
are things.
associate that with that.
Mhm, absolutely. So there's a whole term that I think now in today's health word, people are more focused on the word or the term obstructive sleep apnea.
Yeah.
And that is sort of like an end stage disease. If someone gets and develops a diagnosis of obstructive sleep apnea, that means there's a certain number of moments at night while they're sleeping where oxygen, they're not breathing in.
Yeah.
So there's a pause to their breathing at night. And really, if we zoom out a little bit before we get to that point where that's the diagnosis we're dealing with, we might see that snoring is a warning sign, or if someone's clenching or grinding their teeth, that's another example of a warning sign. Even just restless, kind of tossing and turning, if someone moves around a lot at night while they're sleeping, that's another sign that perhaps breathing is at play,
Yeah.
because the body is such a beautiful piece of science, right? It finds a way to prioritize what it needs to prioritize. So if your oxygen levels are dropping, your body's going to find one way or another to wake you up and get you breathing again. And so whether you notice it as kind of you're really awake in the middle of the night and now you can't get back to sleep, but for some people it's more subtle and it's just the quality of sleep. You might stay in bed for 8 hours and think you're getting that sleep. But if your quality of
Yeah.
sleep is interrupted, that's going to have so many effects on your health as well.
Yeah. I've done the Aura ring before. I mean, I
Mhm.
have one. I don't wear it all the time, but I did it because I was curious at one point because I felt like I wasn't sleeping. And yeah, you'd be surprised how you think you maybe got a good night's sleep, and then my score would be like, yeah, it was, I forget what they called it, but it was bad. It was like basically go back to bed. You didn't sleep last night.
Right.
So you're trying to educate parents about this early, right? So that these children don't grow up with these symptoms that some of us adults already have.
Exactly. That's really, and again, as a general dentist, I was seeing all ages. So I've
Wow.
seen where some adults are coming in with problems that are strictly in the mouth of, maybe they're breaking a tooth and they can't figure out why this keeps happening or something like that. But the reality is, it's always about so much more than what's happening in the mouth. And so for me,
Yeah.
it is so important to understand that from an early age, things like how we chew, how we feed, even just starting out as infants, whether we're breastfeeding or bottle feeding, can make a difference as to which muscles are being used in our mouth. And that can be a part of how the trajectory of our growth is. And anything that I talk about is never meant in any way to shame any parents of
Right.
one method of feeding or providing care for your child. But the reality is, we have to look at, if we know that as an infant there were problems with feeding and we had to rely on more bottle feeding, or our infant was, as things progress, if we have a picky eater who doesn't like to chew solid foods and they prefer a softer diet, which generally speaking, almost all of us have a softer diet,
Yeah.
whether we kind of relative to what, again, our ancestors had. And if we start to look at all of that, if we know what we're sort of up against, we can take a more proactive stance and introduce either the right tools or the right therapies or different things to intervene early on while we're still growing, while a child's face is still growing. And you can really set a child up for better growth. That's not meant to say that there aren't options for adults. There certainly are options.
Yeah.
But so often this goes under the radar. And then you do have an adult with symptoms that are sort of misunderstood. Nobody's connecting the dots to help them understand, again, a lot of there's a strong overlap with a lot of the ADHD symptoms that are going on. And
Really? That's
Mhm,
interesting.
mhm.
Interesting.
Yeah, because again, there's a really strong overlap with interruption to sleep at night. So
Right.
when we don't grow and develop the jaws properly, and it's not only about the growth. I kind of put things in pillars. So we do have the form of the way that the face ultimately grows. We have a function level, and function can mean different things when you start talking about medicine, right? So I kind of further break that down into two. One is going to be more of, we're talking about like muscle function and kind of the things that way, like we spoke about good
Yeah.
chewing. Our ancestors used to chew for like 4 hours a day easily. And now our meals are quick, on the go, soft foods. So many things have changed. And so we've got
4
sort of,
hours.
mhm,
Like, that's hard
right?
to even picture,
I
right?
know they had to put in the work to eat. I mean, it was a different diet back then too,
Huh.
and that's a whole different thing. But so yeah, there's sort of that muscle function, and then there's of course what's going on more functionally, how we think about kind of medicine, functional medicine, and things of that nature, looking at what's going on with how our hormones might be. If there are interruptions to sleep, we know that so many of the hormones in our body are affected. So even children who are maybe slower on the growth curve, it might be because their sleep isn't great. And
Mm.
then again, kind of I had spoken about the attention, and there's just a strong overlap with the population that has attention disorders is already likely to have sleep issues. And so the reality is the symptoms are often overlapping. And in children, it is more likely to manifest with hyperactive behaviors than just fatigue. And
Hmm.
so it's one of the things that sort of seems backwards. No one checks if
Yeah.
someone thinks this child has too much energy, no one's thinking they're not getting enough sleep, right? It's the opposite
Right.
default assumption. So,
Interesting.
yeah.
And I just even when, you were talking about, come on, Jen, what's it called? The thing where you wear the mask, sleep apnea. When you were talking
Mhm.
about sleep apnea even, I'm thinking about how many people I know now that have the mask and the whole system. It just seems like it's the new, I remember when all of a sudden all the children were getting diagnosed with ADHD. Well, lately in my world, everyone I'm talking to, I'm older now, obviously, but it's like, oh yeah, I finally got my sleep test. I got my sleep machine. I'm sleeping better. And it's not just a handful here and there. It's like a lot of people that I know, which is surprising to me because I don't think I ever even heard of sleep apnea until like 10 years ago.
Right. And that it can be a reflection of
Yeah.
really the changes that have happened to how we're growing and how we're developing. And again, for the reality is we don't learn a lot of this in dental school. We don't learn a lot of this in medical school. And so these symptoms get put in the little silo of, this child has this problem or this adult
Yep.
has depression or dementia, and things are maybe not connected back to look at sleep. But even once we identify maybe there are sleep problems, then it's like, oh, well, what other medical problems. Maybe we had issues with thyroid hormones or other things earlier on that could have been kind of earlier warning signs from our body
Yeah.
that weren't understood.
Yeah. That's crazy. That's crazy. Yeah. Um, can you give us maybe one example of something that, like a certain way that a parent is feeding a child or a child is chewing that could potentially lead to issues in the future? and like what they would maybe what you would suggest they try instead, just to give the listeners kind of a practical,
Yeah, absolutely.
example.
For sure. And there are different ways to think about it, but I think probably one of the easiest things to think about that we see all the time, and once you start looking for it again, kind of like the CPAP thing, you'll look
Yeah.
around and be like,
Yeah.
wow, pacifiers, the overuse of pacifiers, while they are definitely recommended by the American Academy of Pediatrics early on to be protective against things like SIDS, the recommendation stands that weaning should start around 6 months of age. And that's really early. If you look around and see the age that most children are still using pacifiers these days, it's a lot later.
Yeah, they're walking. They're
Mhm.
walking, holding their parent's hand. Yes. Yes.
Mhm,
Yeah.
mhm. And so that's something that it's in the mouth, it serves a purpose, and the child might grow kind of attached to it because it does make them feel good. There's certain physiological reasons why they like it, but it does also take up some of the space in the mouth, and the tongue position is going to be affected. And that's something where, again, we don't think about how we're growing, but the tongue actually, when we talked about how bones these days and mouths are kind of squished, the tongue should be resting in the roof of our mouth. And that should be a driving force for some of the growth that takes place to get that nice arch form that our ancestors had, that beautiful arch. And so, in a lot of cases, if the tongue is resting low, because there's been something in the mouth or because that's been the comfortable kind of new normal for that child, then that growth is affected. And so that's an example that I think the easiest thing is to try and look at, like, can we soothe and remove? Can we just kind of jump into a habit like that earlier and take action earlier to recognize that maybe we don't want to rely on that all the time. But aside from just like changing that, as we look into growth and development, we can also look at, maybe we want to introduce a concept like baby led weaning, which is where the baby is introducing solid foods earlier than kind of just going through all the purees and the different food textures that are
Oh, interesting.
softer. So
Yeah.
there are kind of safe ways to introduce solid foods early. And so that's a concept that normally is only applied to like the initial introduction of foods. But the reality is, at all ages, we should be making sure that we have texture variety into our food that we eat. So obviously, there are safety considerations for what's safe for different ages
Right.
and that. But if we know to have the awareness to pay attention to that and make sure that that's part of kind of what's being factored into growth and development, that can be a helpful sort of like counterbalance for some of the activities and things of that nature. Another example, just to kind of tie in with sippy cups. Um, Sippy cups were really developed for the convenience of parents, not for the
Yep.
development of a child, right? And so, by all means, if you need a sippy cup because you're in the car, like, do what you need to do. But if you're at home or you're eating a meal at the table, try and do just training to drink out of an open cup or training to drink out of a straw. And you're going to activate different muscles and get the muscles more naturally acting how they should versus having that little spout just kind of stuck between how we're taking the action of swallowing and things of that nature. It can be an interesting thing to think about how we
Yeah.
swallow.
I
And
never would have thought of that. And
Mhm.
yes, all my children, we had the Tupperware little sippy cups way, way back when.
Yeah.
But like you said, it was to prevent spills. This was
Right.
every day, all day in the house. So it sounds like it's a big education piece that of just getting the word out to parents of kind of some better practices,
Exactly.
of things that we didn't know we weren't supposed to do.
Exactly. And I do have a free ebook guide if anyone's listening and they're curious about other
Perfect.
things. It's something they can find, and we'll give
Link it
information.
in the show notes. Yeah.
Yeah, but there is that whole guide is just things you can control at home or think about at
Right.
home that without having to go to a medical provider or a dentist, you can start to make some changes at home. There are things certainly to empower parents to start taking action early.
Do you ever dream of being a better mom, friend, or person? You're not alone. Life happens, and even your best intentions can fall off track. That's why I created Balanced Life Warrior, a no-fluff, practical course that helps you actually make progress toward the goals you have for your life. There's nothing overwhelming here, just tools that actually fit into your busy day. You belong here. Head to whiterobinwellness.com to get started today. That's whiterobinwellness.com. Yeah, and I think just making parents aware that this is even something they should be thinking about. I certainly didn't hear about this when my kids were young. And also, you mentioned something earlier in our conversation briefly about like the metal fillings versus the newer white ones. And I know, I can't remember where I was reading. I'm into so much wellness stuff. Who knows where I heard something, but I remember kind of bringing it up to my dentist at one point and saying like, "Hey, I think I want to consider removing the metal," because like I have friends in the space who like they were adamant. They went to a special dentist, had all the metal removed, had the new kind of whatever safer put in, and I'm like, I don't love going to the dentist, not gonna lie. but I was like, oh, I should probably do that because I've read some of the research on some of the things that we know now that we didn't know when that type of filling was invented. So
Yeah.
I don't know if that ties in with airway at all, or if that's just something we should be maybe doing something safer now.
I mean, again, so Europe actually, being based in Europe now, Europe banned mercury filling. So when I talked
Really?
to,
How long ago?
not terribly long ago,
Yeah.
it had been kind of a work in progress for several years, so people kind
Yeah.
of knew it was
Wow.
coming. But when I talked to dentists here, most of them had never even placed a metal filling, which is completely different from how I went to dental school. I graduated a decade ago, and we were still placing metal fillings in dental school. And so it's an interesting dynamic. And again, there's different kinds of kind of holistic approaches to
Yeah.
what dentistry can be. And so if you have questions, and again, I know I'm focused on like the early prevention, but there's so much that
Yeah.
can be done for adults when you're looking at materials in the body and how things are interacting. But even for the airway component, it's not ever too late if you have been diagnosed with sleep apnea, to start to explore, are there other things you can do? So there are actually physical therapists. There's a whole brand of sort of a type of physical therapist, we'll say, called a myofunctional therapist. And
Okay.
it's not very commonly discussed. I think I graduated dental school without even knowing they existed, but it's typically going to be either a speech therapist or a dental hygienist or somebody else who has training with the mouth. And now they've become an expert in looking at the muscles in and around the mouth so that they can help retrain the muscles for better breathing, better chewing, better swallowing, better function all around. And that on its own, myofunctional therapy has been shown to actually result in a reduction of the metric that's used for kind of classifying sleep apnea. So somebody who's suffering from sleep apnea symptoms can actually improve their condition with something like therapy. And that may not ever be discussed with them, right? It's kind of like, wear this thing for the rest of your life. Sometimes there are other alternatives like a dental appliance that can reposition the jaws differently. So again, if we're talking about growing children, it can be something that affects the growth trajectory. But in adults, you can still have a dental appliance that's going to pull your lower jaw forward, which results in your tongue sitting forward, which can actually open up your airway space a little bit more and can make breathing, the whole process of breathing, take place with more ease. So it's something that it's never too late for patients of all ages. Obviously, we want to get ahead of it so that we don't have to be, doing this for a child who maybe doesn't have to share that fate. But there's options for all ages, absolutely, for different types of dentistry.
Yeah. So now that you are overseas and the standards are different, the health standards and everything, what are you seeing in children as far as the number of kids that end up having braces? Is it less where you are, or?
That's a really good question. The prevalence here is still pretty high. So I'm in
Yeah.
Portugal, and one of the interesting things about Portugal is they were one of the first to introduce sugar to the world
Oh,
in the exploration days. So there's
keep the
still,
dentist busy.
I do. I think it's related.
Yeah.
But there's definitely still things, and it's a worldwide phenomenon at this point. But that is something that when you find there are certain communities that look at, if you've ever heard of like the Weston Price Foundation that does a lot with nutrition,
Yeah.
that whole discovery was a dentist who went around the world and looked at more indigenous tribes and kind of parts of the world that hadn't been exposed to Western culture, or kind of post-industrial patterns and norms of living, and looking at how their teeth and jaws were completely different from what we were finding in the Western world. So there
Huh.
can be geographic variances for sure. But I think the reality is our modern way of living has so many different factors that are really hard to avoid. And like, it's not like I live some sort of, I use technology. I live a modern life as well. We all have to rely on the world that we live in, but it's something where we have to be more mindful of. I think posture is a great example of that, and looking at how, there's a lot more attention paid now to like text neck and kind of how our
The
posture is
whole
changing with screens. Yeah. But also, the way that we breathe, that's another reason why we may position our head forward, or
like without even knowing it, just it's a
without even knowing.
biological
Yeah, if we're
adaptation. Yeah.
So
Hmm.
either if we're more likely to breathe through our mouth, it's already something where we may lean forward a little bit, because that can actually position our airway and make it easier to get the airway in through that kind of airway tube that we have running through the nose and the mouth down. And it's something that kind of is an interesting factor, because again, none of this is about just the teeth, right? It's the way that we grow and develop. It's going to be things like when we're younger, there's a lot of exploration that takes place through our mouth, and exploring things. You see toddlers sitting
Everything
out,
goes in the mouth. Yes.
everything goes. And so there's a lot of kind of training and things that go into that, but also the sort of trajectory of how we grow. We don't give enough credit to that either. So things like tummy time, you'll hear, parents focus more on developmental milestones and making sure crawling's happening. And a lot of things are starting to change with even just those early action steps. And so how we position our body, that can be affected from early on from certain actions that we take or don't take. We have so many, we call them like containers, that kids are in the car seats or they're in this thing instead of out and about crawling around. And some of that affects how our body grows and how things are coming into play too. And if we breathe, again, going back to the breathing, if we're breathing through our nose, it activates different muscles than it activates if we breathe through our mouth. And so we know that those kind of dynamics shift and how our body can change like that. But even changes in the asymmetries, I guess, is an important thing to think about. So people who have scoliosis might have also kind of asymmetries with the bite and how the bite comes together, but people aren't
Oh,
thinking
interesting.
about
Yeah.
connecting those as well. And so there are things that, again, when we zoom out and we take the full body perspective on things, we might make some connections of how what's happening in the mouth has led to compensations in other places of the body and vice versa. So it's just a different way to think about things.
That's very cool. And so those of us who are breathing through our mouths, I know you said you had some resources on your website. Is it possible for adults, or even we'll say teenagers to adults, to retrain their bodies how to breathe more through the nose so they can get some of those benefits.
Absolutely. So if all you are able to do, that's one of the biggest things that I like families to know, no matter what age you're working at. While I love to try and get people in to change the growth trajectory, that's not always going to be an option. And sometimes we're left with a situation where growth and development is further along. And while there are still ways to modify the growth and development at all ages through certain dental appliances, if nothing else, if we simply rely on kind of retraining our breathing method, that's a powerful tool for our nervous system. That's a powerful tool to decrease the amount of stress that our body's up against. And right now we're up against so many different sources of inflammation and stress on our body that if the one thing that we can control is learning to breathe differently, that's a really powerful tool. And I think it's important because so many people that talk about breath work and things like that might only be focused on kind of the more like active breath work. You're sitting down for a breath work session or something like that. But to really take that a step backwards and say, but like, how are we breathing all day, every day as well?
Yeah.
Absolutely.
Yeah. And you mentioned the nervous system. So how does the way that we've done this wrong in our mouth, or the way we chew and the nose and the nasal and everything, what does that do? How does that affect our nervous system? Like, what's going on there
Yeah.
that shouldn't be?
So absolutely. I mean, I think the biggest way to just kind of look at it is, we have our nervous system has kind of the fight or flight switch and the rest and digest switch. And when we're breathing properly through our nose in a good kind of our exhale should be longer than our inhale, which is very rare if you start paying attention to how you're breathing. Um, it should be through our nose, our exhale should be longer. There are certain things that if we can get that right, we're more likely to activate that rest and digest system to kind of put our body in a more relaxed state. And so many of us, again, when we're breathing through our mouth or we're breathing higher up in our chest instead of in our diaphragm, it puts stress on our body, but it also activates a lot of muscles differently that can be connected with chronic pain symptoms and things that we're not even kind of on our radar to connect if someone's having headaches or kind of certain problems, that perhaps simply learning to breathe differently can be a powerful tool.
And you also mentioned the word inflammation. Is that related at all to the? Because I can't think of a person I know who doesn't have an issue somewhere in their body with inflammation. Like
Yeah,
everybody. Like,
it's true. It's true. And that's, again, why I think we fail to see oxygen as our most important nutrient. It's because we breathe it in instead of digesting it. But at the end of the day, oxygen is driving so many functions in our body. And so if we're putting our body subconsciously into kind of a lower oxygen state, or it's not always going to register that like our oxygen levels are low, but we're just doing it inefficiently. And so there's a certain level of fatigue that our body starts to catch up on, things start to give. So maybe you were fine up until, for example, with menopause, some of the elasticity in the muscles in our neck will change. And so maybe somebody was breathing fine until hitting menopause. And now that's the reality,
interesting.
is they have more challenges. And if that stress is constant to be kind of not getting the oxygen in the way that's most efficient, then it can be something that is triggering that inflammation in the body. So absolutely, there's links with cardiovascular disease and stroke and dementia and different things, that it really does go hand in hand with so many of the chronic inflammatory conditions that can be going on in our body.
It's so interesting. I love hearing from people who are treating not just the symptoms, but the actual trying to find the reason behind and trying to protect the body and prevent some of these things from happening. So I appreciate that so much about you and your work.
Thank you.
So on your website, you correct me if I'm wrong, but you're connecting parents with providers like in their area that can help them with this. Are you only like what countries are connected? Like, do you have US resources? Go ahead and talk about that a little bit.
Yeah, absolutely. So I guess it's a good point to just make before explaining all of that. That part of this, as you're kind of alluding to, part of that holistic mentality is this area of healthcare doesn't only come from a dentist. So people like fascia release providers, physical therapists, ear, nose, and throat doctors, allergists. There's often a multidisciplinary team that has to come into play to get
Mhm.
to the root cause for different families. In the work that I do, I connect virtually with parents. Most of them are in North America. However, I do have clients here in Europe as well. If someone's in a different part of the world, I absolutely can still do my best to get you connected with resources. I originally set up my business in order to help people find the providers and get connected and understand the symptoms and connect all of that. What's really evolved out of my business is that most of the families that come to me are a little further along down that rabbit hole. They've maybe met with different providers or gotten some opinions, and for whatever reason, there's resistance with the treatment plan that's been proposed to them. So that's one of the things that I like people to understand is there's no single best way to do this. If there was a single best way to approach all of this, it would be an easy thing to write out a protocol and say, here you go, everybody. But there's different sets of considerations for what a family is experiencing and what the symptoms are and different things like that. So a lot of times what I do when I meet with families is I help them in kind of the same way that a coach is helping a health coach. I help them understand the different options. I help them look at kind of what's the best fit for them and kind of work through almost like the psychology of moving forward and getting unstuck to be able to pursue the treatment that feels most aligned for them. So that's kind of the little niche that I've kind of built for myself. And yes, it's mostly North America. I do at this point. I am starting to dabble even with if anyone's listening as a healthcare provider and you're kind of like, well, how is this affecting my patients and how is this something that I can be more aware of? That's something that I love to do too, is making sure that the that we're bringing more healthcare providers into this avenue to understand how they can approach their patient care differently too. So I welcome
Yeah.
anyone to reach out, certainly, but the majority of the care that I provide is for helping parents navigate these treatment decisions.
Well, that's great that you're working with providers as well, because I know, or I've heard, that in medical school, some of the things that you'd think would be really important, like nutrition, for example, are like a day course kind of thing.
Yeah,
So
you'd be
that's what I've
shocked.
heard. I have not been to medical school, but I have heard that there are some things that could use some more exploration.
Well, pediatric sleep is a perfect example of that.
Yeah.
It's not enough attention is covered. And even I've connected with a lot of pediatricians to talk about topics like reflux and
Oh,
eczema
yeah.
and things about the gut microbiome, because if we're breathing through our mouth, it's completely shifting the dynamics of our microbiome as well. And so there's just different factors to consider with all of this. And
And that's because that junk is getting into us, right? Because it's
it's
not
a
being
different,
filtered. That is,
yeah, it's a different way to think about
yeah.
it. It changes
Yep.
the bacteria that are living in our mouth, and the mouth is the beginning of that gut tube. So if we're not getting the right kind of set up foundation, but also if we're not chewing food correctly, that can lead to constipation or bloating or
Yeah,
different things.
talk about chewing a little bit, because
Yeah.
my brain is like, isn't there only one way to chew? So like,
Right, I know, and it's thought to be such a simple activity, you don't spend any time thinking about it, but chewing and swallowing are very complex. I actually if anyone's looking for just, like, a moment to be like, "This visually is looking complex," you can look up there's some YouTube videos called, like, "Tongue in an MRI Machine," and it shows people while they're singing, while they're swallowing, while they're playing an instrument, and you just see these muscles moving around in crazy
oh,
ways that you would
wow.
never think about how much is going on in here. But the way that we swallow can have effects on things like how our ears drain. So ear infections might be one of those things that people don't think about connecting. How we chew, again, beyond just driving the growth, it is something that, again, it's affecting gut health. And also, I think it's really important to think about, again, sort of the asymmetries in the body. A lot of people may tend to start chewing on one side only, and that's going to send growth signals to one side versus another differently. And again, that's where something seemingly so simple, if we just try and catch that early and focus on making sure we're chewing on both sides. And sometimes there's a reason for that. If we look inside the mouth, there's something, maybe something called like a dental crossbite, where the teeth are poorly positioned on one side of the mouth. And so for that child, it's easier to chew on
Yeah.
one side than it is. And we're always going to follow the path of least resistance to do something that's easier for our body. So there's a lot that just gets kind of brushed aside as we just innately know how to breathe. We innately know how to chew and
Right.
swallow, but that should be a process that's developed over time with the right sort of introductory steps. And so often we bypass a lot of that with like pouches, applesauce pouches and things that are the
Things
modern.
that didn't exist when my kids were little, but yes, I do see them all the time, and anyway,
Yeah.
it's a new time.
Time. And we, by all means, use the conveniences, but have the awareness that it shouldn't be the all the time default. That's all.
Yeah, interesting. Okay, so early on in the conversation, we talked a little bit about fascia. And if you've heard from the podcast, I'm fascinated by fascia lately and how it connects in the body. So I'm curious what you can tell me about the fascia that's actually in the head, in the jaw, and all of that.
Absolutely. So yeah, fascia is one of the fascinating discoveries that has come to light more recently. I think it was while I was still in dental school, we kind of like moved the fascia aside to look at the other structures. Again, when we were doing like cadaver lab, it was like move that out of the way and look at that important nerve there or something. But the fascia runs through our whole body. And one of the ways, there's different ways that fascia can really come into play for the work that I do. One is there's actually fascia that runs through from the tip of our toes to the tip of our tongue. It's like when we talk about the fascia lines in our body. And so one of the things that's kind of more of a buzzword lately is something called a tongue tie. And that is just something where we all have a little stringy part underneath our tongue. It's just kind of the scaffolding of how our tongue is formed. And for some people, it dissolves away more quickly than others. And for some people, it persists. It never dissolved all the way. And there can be effects to kind of range of motion if that fascia line is held really tight. And that's something that, again, when we were in dental school, we were initially taught what they considered a tongue tie at that time was only when the tip of the tongue was held by that little string. Like truly people can't lift their tongue, and that's a very severe tongue tie. And of course, we've spent time talking about how important the tongue function is. That's absolutely going to make somebody a mouth breather. That's going to affect their digestion. There's a lot of implications from something like that. But we've started to understand more that there's, of course, a variance of not just that most severe presentation, that it can be something that's affecting range of motion, even when it may not be as visually obvious. And so sometimes it gets dismissed by a pediatrician early on or a lactation consultant. Sometimes it's something where, on the other hand, the lactation consultant might be the first person that's identifying a problem like this. And so it's something that's one way that fascia can kind of come into play, is a true physical restriction for the tongue. But another way that it comes into play that maybe is more subtle or nuanced might be something like torticollis, or something where a child is...
Say that word again. What was it?
The word is torticollis.
Okay.
It's going to be if you notice a child perhaps having a favored preference of a side. So maybe every time you take a picture of them, they're always looking to the left. Or when they go to feed, they only feed on kind of facing the same side. Sometimes when children may have like head shape differences, you'll see them kind of getting that helmet or something like that to help with head shape. It might also be because they are consistently going back to the same side. And that can be tight fascia as a part of the equation. And so that's something where, again, we can work with perhaps an occupational therapist or a physical therapist that works with children that can try to change that early on. Because if we have something like that where it's tight, then that's going to, again, start to build asymmetries in our body early on and influence the growth trajectory. That may have effects either from kind of driving the symptoms from something in the tongue, but even like I just said, if it's tension in the neck or elsewhere in the body, then it may just affect how we grow and develop and move through those other milestones and things like that. So I think it is a topic that's, again, underappreciated in the medical community, but I think it's an important factor.
Well, I think you've given everybody a lot to think about. And thank you for sharing so much information that I for sure didn't know. I guess we've learned a lot since my kids were little. Sorry for the sippy cups, kids. We didn't do pacifiers though, so
no apologies needed. We do the best we can in the states that we are living in. So,
listeners, if you want to connect with Dr. Julia, share where the best place is for them to do that.
Yeah. So my website is oriswellness.com. And from there are other links that you can follow to get connected through different avenues as well.
Perfect. Thank you so much for being here, Dr. Julia.
Thank you for having me and for having such an open mind to exploring all these different topics.
Thanks for watching. Let me know what your biggest takeaway was. Just drop it in the comments and don't forget to subscribe for more.